Good day, everyone. We are going to be talking about some sneaky reasons why our bodies may not be absorbing the nutrients properly that we require. And this comes from a Dr. Jocker's article on the 12 surprising factors that influence nutrient deficiencies. If you have any questions during this talk, please feel free to give Dr. Justine a text at 647-987-9355. I wanted to welcome Dr. Justine. She is our leader here at the Justine Blainey Wellness Center, and she is a passionate warrior for your health. Her main objective is to be able to provide you with the best care for you so that you can be the very best version of yourself. Please help me welcome Dr. Justine.
But today we're talking about 12 keys that influence nutrient deficiencies. When you think you're doing everything right, but your body just isn't absorbing. So, what are some of those nutrient deficiencies? They can be important because they can be the root cause of some major chronic diseases, and it can go way beyond poor nutrition. It might be you're doing everything right, but you're not absorbing that information. So today we're going to learn about those 12 key factors. First thing we're going to learn about is the micronutrients and the macros. You hear this when people talk about weight loss. Did you get your macros? Well, let's talk about that. The micros are the chemicals that are in trace amounts. They typically come in three forms: vitamins, minerals, antioxidants. And it's really hard to pinpoint these. So this is the small picture of the smaller elements and quantities that we need. And one of the tests that you can do that with the naturopath is hair analysis to do mineral analysis. I remember doing this and I realized that I had low copper. So, sometimes it wasn't something that I thought about as, trying to have copper in my body. So definitely it was interesting and a way to change how I ate on ongoing or supplementation. Now, the macros are the bigger picture, and that's what you hear about when people are talking about weight loss diets. You will see these are more the calories, and they also come in three forms: your carbs, and of course, we want the healthy carbs, your fats, the healthy fats, and your protein. So carbs, fats, and proteins, this is one we're more familiar with, and this is the one we eat in larger quantities. When we talk about absorption of these nutrients, it's super important because your body needs both micro and macronutrients in order to function at the highest level. The minerals are inorganic materials. They're found in the soil, they're found in the water, and our soil just isn't what it was before. So our food is not what it was before, and these minerals cannot be broken down. These vitamins are organic compounds that are found by plants and animals, and they can be broken down by water, heat, acid, depending on which vitamin it is. Now, if we look at the role of these micronutrients, they can help with brain fog, mental health, your digestion, your thyroid. They can help affect your bones. They can affect the job of these is to help your nutrition, help your energy, help your digestion, help your metabolism, help you break down the good foods, help you make hormones, help you deal with oxidative stress, help you remineralize, help you make new good cells. They help with creating new bone called bone mineralization, and they help protect your brain. So we absolutely need to make sure that we have these micronutrients in our body: the calcium, the potassium, the vitamin C, the iron, the B vitamins, the E vitamins, C vitamins, D vitamins. Like, we need these micronutrients, but if you don't test, you don't know. And that's why with the naturopath, you can do a mineral analysis to see if you're low and is that affecting your hormone balance. Now, if we look at are we functioning well, when you get a lab test, they have ranges, the low range to the high range. And typically on a medical test, when you get the blood work, it'll only tell you if you're abnormally low or abnormally high. So on the far ranges here. But ideally, we want to make sure we're in that middle range or the functioning high range. So that is why it's really important to get a good set of eyes with a naturopath on your blood work, because these ranges don't stick out as much. Now, optimum versus adequate nutrient status. So when you're optimum, you're energetic. Woo, you're ready to dance, you're ready to run, you're ready to move. Typically, the medical system will look for just adequate. So it's up to us to decide if we just want to be average, we just want to be status quo, or do we want to really optimize our health so we can be the best for our family, for our loved ones. And here at the Justine Blainey Wellness Center, we're talking about turning that dimmer switch up, helping you optimize your health so you can be the best version of you. So there are 12 factors that influence our nutrient status. It's the whatever we intake and we eat, our anti-nutrients, the oxidative stress, how we absorb our food, our gut microbiome, our cellular nutrient uptake, our blood sugar levels, and our lifestyle levels, our health challenges or any diseases or genetics, any medications we're using, toxins can affect our overall health. So we're going to cover these 12 factors that influence our nutritional status. Number one, if we look at our nutrient intake, we need to know, is it good or not? And that's one of the reasons why with Sabine, our holistic nutritionist, she'll do live blood cell analysis to look at your blood and see, are you doing well or not? Literally, the soil that we eat food from isn't what we were having before. The rain isn't what it was before. The soil isn't full of nutrition like it was before. Now we deal with early picking of produce so that it can travel long distances. It can be stored. It can be processed. Cooking can interfere with it. So reality is many eating challenges come just because the food isn't what it was before, or it's related to calorie restriction, restriction of certain types of foods, purging, or other disordered habits. So number one with our nutrient intake is really knowing, are we eating enough? And that's why doing the live blood cell analysis and the mineral analysis with the naturopath and a holistic nutritionist can help you test, not guess. Like, how do you know if you're doing well if you don't get tested? Number two is dietary anti-nutrients. These affect our absorption. These are things like lectins, goitrogens, salicylates, phthalates, oxalates. And so those are like all big words. What the heck are those? But these are things that are in our food that make our food not absorbable, so they don't function well. So some of the things that help us digest better is doing things like sprouting, soaking, fermentation of certain foods. Now, I can't say I'm good at that. That's not my forte. But luckily, some of it can be done for us if you go to health food stores, or our naturopath can teach us. So some of the anti-nutrients that are really going to destroy our gut health, destroy our absorption of the nutrients, macros, and micronutrients is gluten, especially since in Canada, North America, the gluten is different here. The wheat, the way it's sprayed, the way it's been handled is different than, say, in Europe. So gluten, sugar, refined carbohydrates, certainly conventionally raised meats versus free range. So things that are farmed can affect us. Farmed fish, farmed products, processed meats, like I grew up on bologna, or sausages. So looking, towards those processed sandwich meats can affect us. Certainly trans fats, things like fries or fried foods, food additives, things that make your freezies colored or your smoothie colored, your, fancy drink at Tim's that is not real fruit, just to make it taste good. Those preservatives and colors in popsicles and Gatorade, high processed oils, especially seed oils, and artificial sugars. All of these are anti-nutrients. So when we look at the dietary anti-nutrients, you can be aware of these plant toxins, the lectins, phthalates, oxalates, salicylates, These are all chemicals that can be found in our foods that can be due to environmental stressors. Number three is looking at insulin, oxidative stress, and inflammation levels. Again, you can have your inflammatory markers tested with your blood. And just had a patient just this week sent they were fully inflamed. You could see the inflammation in their legs. Sent them to the hospital saying this is a totally inflammatory disease. And the hospital refused to do the inflammatory markers blood work, only did a regular panel. So then they had to leave the hospital, go to their medical doctors. Even though I'd written it down what tests to get done, they still refused to do those tests. Went to the hospital, and sure enough, her medical doctor ordered, and her C-reactive protein was through the roof. So getting homocysteine, C-reactive protein, A1C, that can be tested, but a lot of medical doctors will not order it, and you need to go through your naturopath. Chronic inflammation is the key factor to disease-related nutrient deficiencies, insulin deficiencies. So chronic inflammation can affect your memory, it causes cognitive decline, it can affect your blood vessels, leading to increased risk of heart attack, abnormal cellular growth, increasing risk of cancer, affecting your gut lining. So that affects how your body's energy is functioning, autoimmune diseases. It can affect muscle growth, weight gain, visceral fat, like when people talk about fatty liver, sagging skin, and joint pain or joint loss. So oxidative stress inflammatory can be truly damaging to all the different organs and tissues and joints in your body. So it's truly important to have your inflammatory markers tested. And again, regular blood work does not test it. You have to make sure you're asking for and making sure you're getting those inflammatory markers tested. And if your medical doctor refuses to do that, see a naturopath and they will help you. So, number four, digestion and absorption. You might be doing everything right, eating all those good foods, but you have SIBO, you have bacteria in your gut, your saliva isn't what it should be, your bile acid, your stomach acid, your pancreatic acid isn't working properly. So, you're not digesting those nutrients. So, literally, the food you're eating is just going in the toilet. So, it's very important to have your digestion tested and work on that gut health. So when we look at number five, we're looking at that for number four, digestion and absorption. We want to make sure that that whole tube of all the food going through all those tubes in our body is functioning optimally, and there's no inflammation, no polyps. And when we're under stress, literally that tube isn't pumping the same. So you get food that's stuck. And that's also when you can do different types of colon cleanses or colonoscopies. We often refer to Marlena, who does water through the colon to help flush out all those different pockets of food that get stuck to help your gut lining heal. It does take about 45 minutes. The water goes in through the anus, it fills up your stomach, and then it drains it out. And you can tell the difference because you go from brown feces to black old feces, and you feel really like empty, like almost starving afterwards. But it does help heal this gut lining, and stress and lack of sleep can damage the gut health, which then affects that absorption of all the good foods. Even if you think you're putting good gas in the tank is rusty. So very important to get the tank cleaned out. Number five is with your gut microbiome. When it's not functioning well, it affects your immune system. It affects the bacteria in your gut, so then you can't absorb those vitamins. It affects your metabolism, so you are not absorbing with your gut flora. So then you can't even use the good food. It can, of course, affect weight gain and obesity, inflammation in your joints, and even affect brain function like autism. So we see a ton of autistic patients. Autism is definitely on the rise. It's pretty sad. They're now saying 1 in 20 to 1 in 21 young boys, babies, 1 in 40 kids. And the gut health plays a huge role in this for the mom. So clearing out the mom's gut helps the baby's gut, and then that helps with breastfeeding. And then, of course, as you introduce foods and challenges, we're dealing a lot of people with bottled food or canned food, not homemade food, which has a lot of chemicals. So our bad gut health affects inflammation, which then affects the whole quality of our life. As we get into that cellular uptake, it also affects hormonal balances, insulin balances. It's super important. Again, test, don't guess. You don't know if your tank is rusty unless you get it tested. You don't know if your gut health is poor unless it's already very bad and you're getting symptoms. Key is get it checked before you have symptoms. Number 5 is looking at the fact that we have so many amazing cells, cellular uptake in our body. The cool thing is we're remaking cells in our body all the time. You're getting new skin all over your body within just a month, 28 days. New liver. All right. That's why alcoholics can create a new liver within 500 days. New intestinal cells. So your gut health within 3 days. So 3 days of changing your diet can have a huge impact on this cellular impact, so that your healthy cells allows nutrients in and out through the cell without blocking that nutrients. New blood cells within 3 months, 120 days. That's why you can give blood approximately every 3 months. And new white blood cells, that's if you cut yourself and you're creating a scar, that's happening almost instantaneously within an hour. Number 6 is looking at our blood sugars. We always think of that as related to diabetes and insulin. The more challenges we have with blood sugars, insulin resistance, the more inflammation we have in the body, which affects our ability to digest those micro and macro nutrients. Number 7, as we get into lifestyle factors, sun is key. So beautiful weather coming our way. Get that vitamin D, ideally 45 minutes outside every day. And be cautious with these sunscreens. We put some different handouts out. So many toxins in our sunscreens. So looking towards, sometime without sunscreen. Of course, not getting a sunburn, so risk of sun cancer, but getting those rays without sunscreen, and then looking towards some of the healthier sunscreens if you can. Some of those lifestyle factors is definitely getting our body moving. The more we move, the better circulation we have through our entire body. Our body is designed to sweat. Sweat gets those toxins out, and it helps us function better as long as we're not getting dehydrated, low electrolytes, low sodium, magnesium, potassium, so low chloride levels. So getting half your body weight in water. If you are sweating a ton like an elite athlete, that's when people might do electrolyte drinks, looking towards healthy ones, not the Gatorade that's going to destroy your teeth and your gut health, or adding, for example, a little bit of Himalayan pink salt into your water, onto your foods to help you rehydrate. Some of those lifestyle factors affect chronic stress. And so looking at some of our other talks, getting adjusted, getting a massage, getting acupuncture, learning mindfulness, doing mind-body work, our psychotherapy, other areas. That's why we have such an amazing team at the Justine Blainey Wellness Center. Everything is to reduce stress so that we can absorb these nutrients better. Number 8 is some severe health challenges can affect our nutrient absorption, and that means we're going to need some more help. So chronic infections, acid reflux, inflammatory bowel diseases, thyroid concerns, diabetes, increased alcohol, heavy menstrual cycles really affects mineral balance, and low iron, and different surgical procedures increase that overall stress, increase that overall challenge, which means we just have to work a lot harder to help get those macronutrients like C, iron, zinc, your electrolytes, your B vitamins, your magnesiums, to make sure they're not depleted. Number 9 is something that many people don't think about that affects our mineral balance and our nutrient uptake is certain medications. Different medications can affect things like our B vitamins. For example, things like antacids really do affect our mineral absorption. Antibiotics can affect our mineral absorption. Many of the heart medications will affect B vitamins as well as CoQ10. So, looking at a naturopath saying, okay, you've been prescribed diuretics, you've been prescribed a contraception, you've been prescribed a beta blocker or an anti-inflammatory. What vitamins do you then need to increase in your body because you know that they're not going to be absorbed while you're taking that medication? That requires a health expert looking at the medication you've been given and prescribed, and then how do you adapt during that period? What supplementation do you need? Number 10 is environmental toxins. And the reality is, none of us can get away from environmental toxins. It's not just stress. The processed foods, the way the foods are um, uh, processed or even grown, the air, the water, the rain, different types of food sensitivities, all of that are toxic stress that affects our overall bucket of stress and then it overflows. So when there is that toxin burden, there ends up being a critical threshold, like where the bucket is just full and then it overflows, that leads to sickness and malabsorption. So that's why doing detoxes is super important, typically about 4 times a year, minimum 2 times a year, many different types of detoxes. Sometimes it's just a veggie fruit weekend. Sometimes it's just doing a fasting over the weekend. That's probably the cheapest way. But also looking towards support, because when you do a detox of these toxins, many times you can feel quite horrible. You can feel poisoned almost, headaches, migraines, achy joints, diarrhea. So when you're doing detox, ask your naturopath for support. Number 11 is there are certain genetics that can make it very difficult to absorb B12, your folate, your zinc, your B vitamins. How your methylated forms of B vitamins, how they're being absorbed, can be affected by genetic information. And if you do have genetic concerns, definitely get the medical support and natural support with a naturopath that you need. Some of the 6 best ways to support your nutrient status is talking to your naturopath, making sure you're getting sugar stabilization. This means you're not having highs and lows through the day. You're not having sugar cravings. You're not starving or hangry. You're organizing your snacks and your food throughout the day. You're getting supportive probiotics, prebiotics for your gut flora, supporting your microbiome, getting the sleep you need. For me, that's definitely getting to bed before 11, not just before midnight, but making sure you're laying down before 11, so that way the sleep before midnight and the rest before midnight counts that much more. Get your sun exposure and a quality multivitamin. In our household, we do have that vitamin D, vitamin C, zinc, good multivitamin, NAC, good B vitamins. We're making sure we take those supplements. I'm the one that puts them out in the morning to make sure we keep our family healthy. So, some of the 6 best ways if you're trying to protect against the ways that destroy how you absorb those nutrients. Number 1 is the anti-inflammatory diet. That's getting away from those processed foods, those healthy, wild foods that are free range versus farmed or conventional meats. You're looking towards those healthy fats, getting that half that plate green, and looking towards doing that green plate twice a day. You're looking towards really healthy proteins, healthy fats, and getting away from those fried foods, those refried grains, those seed oils. That makes a massive difference increasing your inflammation. If you need help on an anti-inflammatory diet, talk to us. We will teach you the advanced plan. Number 2 is supportive digestive health. Things like ginger, lemon and water, getting away from those conventional meats. Making sure you eat water before or after a meal, but not during a meal if you have trouble with digestion. Making sure you're getting quality protein and enough protein, 100 grams or more, maybe your body weight in protein per day. Looking towards fermented foods and fermented drinks. Um, and when you're eating your largest meal, to slow down. That is a challenge for me. Put your fork down. That is a challenge for me. So when I look in the mirror and go, I got to work on that one, to slow down your eating and to eat that meal more slowly. Your largest meal of the day, whether it's ideally it's not dinner, but whether it's breakfast, lunch, but that largest meal that we slow down and allow our body to digest it better. Making sure, number 2, is our digestive stomach acids, improving bile flow. So definitely that's something you test with the naturopath. Number 3 is looking towards your gut health. So adding those good probiotics, prebiotics, looking at your SIBO if you have any overgrowth of the poor bacteria in your gut. So definitely this is something that you would talk with your naturopath or your nutritionist. And number 4, reducing stress by getting quality sleep. So a cool room, we have the blackout shades. Some people might need a mask. Not your phone near your head, not your TV right before bed, no blue light right before bed, caffeine in the morning, not right before bed, food not right before bed, sun not right before bed, but getting it during the day. Getting that exercise. I know if I play hockey right before bed, it's hard to get your body to calm down. So trying to get that exercise earlier in the day, and winding down with light. So lower exposures to light right before bed. Making sure you get that quality sun exposure. The sun is going to help you make vitamin D, aiming for about 45 minutes a day of getting quality sun exposure with more of your skin exposed without getting sunburnt. And number 6, a quality multivitamin. This is the one that I take. That's why we have it in the office. It typically, you want to get something that is going to bind properly and do well with your digestion. So you want to make sure you're staying away from things like Pharma Plus, Kirkland. You're staying away from some of the poor quality vitamins that have a lot of filler, and try to aim towards the higher end quality. Otherwise, it's either doing damage or it's going in the toilet. So when we're balancing, we're looking towards half our plate green if you can, in order to help your overall digestion and nutrition and protect your gut. When you protect your gut, you have better absorption of those nutrients. And of course, when you're getting adjusted, that helps your brain send messages to your gut so that you're functioning at your best. Your nervous system controls all function, how you digest your food, how you move, how you deal with inflammation, how you get oxygen to your brain to be able to function your best. And the only way to know if your nervous system is functioning well is to get it tested. So I recommend you see your chiropractor, do a nerve scan, do a subluxation scan, check how your nervous system is functioning, because it is the main controller in your body and will help when you find and remove those subluxations that we create from carrying purses, from sitting at computers, from even sleeping in the wrong positions, playing sports. All of those driving can cause damage to the spine and nervous system. So getting regular maintenance will help your body be under less stress, and then you'll be absorb those nutrients better. Stay tuned with us. We always have lots of great information here to help you. Please do a review. Our goal is to help you be your best, optimize your true health. We'll see you soon.